timing I've ever seen.
Heard it all.
Look at that. And we're going to cover your face for a second with your name. So Dr. Pearl,
There you go.
former CEO, Permanente Medical Group, author, and all around good guy, doing some good stuff in this space. So Dr. Pearl, the first question goes to you. What is the state of AI in healthcare? Kind of paint the big picture for us so we can get the ball rolling here today.
I think we have to look short term and longer term. Today, what exists are two sets of applications. One that's very powerful is the ambient listening in the clinician's office, where a generative AI tool will listen to the interaction between the doctor and the patient and generate electronic health notes, which was one of the biggest complaints clinicians had as they were staring at their screen rather than seeing their patient and spending 1 to 2 hours a day documenting the visits for insurance claims and prior authorization requests. So that is a solution that's in place. Quite a number of companies are doing it. And there are a variety of other administrative tools, particularly ones that allow doctors to obtain prior authorization and complete the claims billing process, payment methodology that's required. But I think the biggest opportunities are way beyond that. And as you say in my book, ChatGPT MD, How AI-Empowered Patients and Doctors Can Take Back Control of American Medicine, I focus on the patient first and the ways that this technology will allow us, I think, to save hundreds of thousands of lives, be able to make healthcare affordable for Americans, and actually reduce the burnout clinicians feel because it starts with empowering the patients. And I'll just briefly mention one area that I think we can dive back in the rest of this podcast today, this broadcast today, and that is specific to chronic disease. Chronic disease accounts for 70% of doctor office visits, 70% of medical costs. Their complications are heart attacks, strokes, kidney failures, and cancer. We do a relatively poor job of managing them today. We have 400,000 people who die annually from misdiagnoses. We have probably another 500,000 who die from the fact that we control hypertension, diabetes, heart failure, nowhere near as well as we should be able to do so. And this technology is sitting on the edge of being able to provide that, particularly after the most recent release of a tool called DeepSeek by a Chinese company that's open source and will allow entrepreneurs to build on top of it.